Okay, once again, welcome. My name is Kate Brock. I'm the Executive Director for the Community Education Center of Elk-Cameron counties. And we create programs that particularly help students like yourselves to explore careers, explore career pathways, different industries. Today's session as part of the high school career fair event is to provide you with an opportunity to gain more insight and exposure into two very different fields. One is as an environmental education specialist, and maybe a couple of other careers within a state park system, as well as careers in pharmacy with a pharmacy director. So our two career speakers today are Kim Lott, she's the environmental education specialist for Cinemahoning State Park, and Gary Malacarnege. I should have asked you.
Malacarnege, it's a tough one.
Is the pharmacy director for UPMC Cole. So just a quick hand show. How many of you have been to Cinemahoning State Park? Almost everybody. Very good. Okay. And how about how many of you have been to UPMC Cole?
Hopefully nobody. They're young.
Right. A few reluctant hands, but hopefully it was a good experience. So, all right. So, I'll first, we're going to just kind of do a back and forth to keep you guys engaged with these two very different careers. First thing we ask our guest speakers to share with us is their personal career pathway story. So, think about where you guys were, Gary and Kim, in 12th grade, sitting in high school thinking, where were you going from there? Where did you want to go? And what kind of happened in between? And how did you get to where you are today?
Go ahead, Kim.
Okay, I can start with that. So I grew up on a farm. Grew up actually on an apple farm in Adams County, Pennsylvania. So I am originally from Pennsylvania. Spent a lot of time in the outdoors, especially on the farm and in the forest and the woods behind our house. I knew I always wanted to do something with the outdoors, and I thought I wanted to do something with agriculture. So I was very active, like in 4-H and FFA and that sort of thing. I knew that I wanted entomology, which is the study of insects, but I wasn't sure where I wanted to go with that. So that's where I was in high school. I went to college at Penn State University and majored in entomology, which is in the College of Agriculture, which exposed me to lots of different areas of agriculture. So I'm not sure how far forward you want me to go, but I did have another career before I had this one, but it wasn't a really good fit. So I did change careers when I was in my 30s. So we can talk about that a little bit longer, a little bit later. How do you want to do that, Mrs. Brock? So. Oh, you're muted.
Yep. Well, I think it's okay. Talk about this is your career pathway story. So if you want to,
so I went to college, majored in entomology, which is the study of insects. Yes. Now it sounds a little bit strange, but when I was growing up, I knew at least 6 different entomologists. There was an entomology research center in the town where I grew up. I knew different people that had their PhDs in entomology. Spent a lot of time in the orchards. So really I wanted to work with integrated pest management, which is helping farmers understand the role of natural and biological controls rather than just going out and spraying insecticides and pesticides all over the orchards. How can we work with nature to help protect the crops while improving the environment? So while I was in college, when I figured out that that's the direction I wanted to go, I started taking more environmental classes, but still with the mind. When I graduated from college, I got a job with Rutgers University. So yes, I did leave my rural part of Pennsylvania. I went to New Jersey for 6 years and I worked with Rutgers University Extension Service. And that's what I got to do. I visited all kinds of different farms out in New Jersey, went to the apple farms, the peach farms. I even went to some of the best vineyards in all of the East Coast. And I got to visit them and help them use nature to help control their insects so that we could decrease the amount of pesticides that are in our food and our drinks. interesting, but I found through that job that I wasn't really cut out for commercial agriculture and the stresses that go with that. I mean, farming is tight. I mean, every dollar they spend means there's another dollar that they're not using to buy clothes for their kids or food. And it really is really tight, very competitive business. And I realized I just didn't have the heart for that. I like the education side of my job. I like talking to the farmers about the insects, about nature, about environment. And I found that communicating with people was probably more my forte than making those life and death business decisions. So I found that that wasn't the right career for me. So I moved back home, and eventually I found this job through other activities. And I'll talk to you more about some of those.
That's interesting. Interesting. Well, I think back, boy, and it was a long time ago when I was in high school, but I think back to when I was in high school, I really at that time had a real knack or a real interest in chemistry, biology. And I had actually thought about becoming a veterinarian at one point, but I was really interested in becoming a physician, actually, when I first got out of high school. I went to undergraduate school at Duquesne University in Pittsburgh, and in my second year at Duquesne, I decided that I was much more interested in the medical, clinical medicine side than I was in the diagnostic and office and things like that. I also at the time had a good friend who was a pharmacist in Ridgeway, which is where I'm originally from, and had spent some time in the drugstore there with them, and that really piqued my curiosity. So I switched my major at Duquesne from pre-med to pharmacy, and graduated from there, and actually began my career as a retail pharmacist at a local pharmacy in Johnsonburg. Worked there for 3 years. And kind of decided that I really wasn't using the knowledge and the clinical training that I had received in school. And I really wanted to, to work closer with doctors, nurses, patients. So an opportunity came up for me to become the pharmacy director at Kane Hospital. So I became the director there, worked very hard there, developed a lot of policies, procedures based on, clinical evidence, best practices. And at the time, I really was seeking more knowledge. And it was probably about 10 years after I graduated from Duquesne that I decided to go back to school. So took some time off, went to Florida, and at the University of Florida, I got my doctorate degree. So came back with much, much more knowledge as far as treating patients clinically, monitoring patients, looking at their drug therapies, making recommendations to providers and nurses and things like that. And then also on the administrative side, being a director, not only did I get to work as a pharmacist and do clinical, but, I'm also responsible for, policies, procedures, my staff. I right now have a staff of 11 that work under me, budgeting, just a lot of things that you would never think of that a pharmacist would be doing. So a lot of accounting things, a lot of administrative things. And I spent 16 years in Kane as a director. I was in Bradford at the hospital there for 10 years as a director. And then an opportunity came here at UPMC Cole, and I became the director here 11 years ago. And I can tell you, I've never regretted the path that I've taken. I love what I do. I love working with providers, nurses, patients. Nothing makes you feel better than when you can help a patient, help a provider through a tough case, or help a nurse through a situation. And that's my story, pretty much.
That's great. Thank you, Gary. So I'll just take a moment to remind the students, if you have any questions or comments, feel free to use the chat at any time. I'll be monitoring it and be able to respond or ask our guest speakers any questions that you have. So Kim, let's switch back to you. Tell us about a typical day in the life of your job.
When I saw that question on there, my answer is there's no such thing as a typical day. Anytime I would try to tell you what my day looks like, believe it or not, the very next day it's going to be topsy-turvy and completely different than that. And that's one of the things I like best about my job. I recognize most of the faces here that are watching us today. I know most of you have been to the park. Some of you have been to the park many times. So you're familiar with where I work. I report to work here at the Wildlife Center at Cinemahoning State Park. I do have an office. I have a nice size office with a window and a decent sized desk and, my own computer that I don't have to share, which I'm really happy about. I can't say that for all park educators. I can't say that for all park staff, but I think we're really well taken care of here. But I would say other than reporting to work at the same, well, I can't even say that. Reporting to work usually at 8 o'clock every morning. Other than that, I come here, I check my email, and then my day gets topsy-turvy. So I spend probably half of my week planning my programs, half of my week presenting programs. So my job as an environmental educator, I prepare, present, and coordinate programs for not just school groups, so school field trips like you guys have all been here. It would also be for the public. So I do programs for senior centers. I do programs for scouts, for preschoolers. I do programs in the campground and I don't know who's going to come to show up for it. I do walks, I do PowerPoints, I do pontoon boat tours. Sometimes I get paid to tell really bad jokes while I'm giving pontoon boat rides. So I'm really a wide range of things, but the thing that all of those have in common, or two things. One, they all take a lot of planning. I may sound like I'm just talking off the top of my head, but a lot of that takes a lot of research, a lot of planning. You prepare the PowerPoints, you prepare the talks. You guys have all given oral reports at school. Even if you find that the topic that you have, you're very interested in, you have to put the time into it. So that's what I do for about half of my week is prepare. The other thing that everything kind of ties everything together, it's all environmental based. DCNR is Department of Conservation and Natural Resources. So we conserve and sustain the natural resources, not just for today's generation, but also for future generations. And we want them to both use them and enjoy them. State Parks focuses on environmental education and outdoor recreation. So that's why I love my job the most. So typical day, no such thing, but it may include such things as checking my email, writing reports. Yes, answering public questions. I have to answer the telephone. Sometimes I'm working the front desk. You come here to buy a hoodie, I might be the person who does your sale. So I have to stay flexible and help out anywhere. Staying flexible means if one of the flower gardens needs to be weeded, guess who does it? That may be my job on some days. If the pontoon boat needs to have its battery pulled and replaced, that might be my job. So I never know exactly what I'm going to do from one day to the next, but it all is all centered around environmental education and outdoor recreation. So again, hikes, boating, school programs, PowerPoints, all of that, setting up displays in the Wildlife Center, all of that is part of my job. Yeah, my job is pretty awesome. It's really amazing, and I really feel lucky to be here. Go ahead, Gary. It's not a competition, remember.
Oh, I know.
Don't have to include
My day, I can honestly say kind of the same thing as Kim. Every day is different. In healthcare, that's just the way it is. Every patient's different. Every situation's different. My typical day starts real early in the morning. I'm usually here by 6 or 6:30 in the morning. The first thing I do when I get here is I check all my emails, all my voice messages, which sometimes takes me, the first half hour of the day to get through. What I usually do then is my office is not actually in the pharmacy. It's around the corner from the pharmacy inside our OB and nursery unit here. So I usually make a trip over to the pharmacy, check on my staff, see how everything is, get from them any issues or things that happened overnight or that are going on that morning that we need to address. I can tell you there's always fires to put out almost every day. Some of them are very small. Sometimes they're a little bigger. But once I get that, my day starts, then I start addressing those issues, those problems. I come back to my office. If I can take care of it on the phone, if it's just a conversation, with the patient, with the nurse, with the provider, with someone else, one of the other healthcare workers, I do that. And then I move into my meetings. Unfortunately, I attend a lot of different meetings. I'm on a lot of different committees here at the hospital. And that's because I'm the director. As a pharmacist, you would just be, and I do staff some days in the pharmacy because I only have so many pharmacists. I have 5 pharmacists. One of them's off. I may be staffing in the pharmacy. So that looks a little bit different than me with my administrative hat on. So I attend all my meetings. I do try to check in on the pharmacy from time to time throughout the day, report back to them. We have monthly staff meetings. We have daily huddles just to keep everybody up to date with what's going on. As far as if I'm staffing, which I was doing this morning, we start at 7 a.m. First thing we do is we have a lot of reports that print out for us first thing in the morning. And those reports provide me with the names of patients that I need to monitor and look at for that day. We adjust drugs based on their kidney function. Some people's kidney function is not as good. You have to readjust the doses. We look at patients who are on anticoagulants, which are drugs used to thin your blood, to make sure that those lab values are in range so that they don't bleed. We look at antibiotics to make sure that patients who are in with infections are on the right antibiotic for the bug that we find growing in them, wherever that may be. If it's in their lungs, if it's a cellulitis, different things like that. We also verify all of the provider orders, which is a task in and of itself. It's amazing, people think that, providers are foolproof, and when they put an order in that, everything's perfect, and but they mess up once in a while, and they might not put the right strength in. They might put the wrong dose in. They might put the wrong frequency in. So that's our job. We're the drug experts. So we're constantly on the phone talking with providers. Just making sure that we are providing our patients with safe and effective therapy. And as the day goes on, there's other tasks that are carried out by pharmacy technicians, which are also, part of the pharmacy team here at the hospital. They do things like stock our automated dispensing cabinets. They mix the IVs so the pharmacist can check them. They do out-date inspections of drugs throughout the whole hospital. There's just a lot of different tasks that they carry out that a pharmacist really doesn't need to carry out, even though the pharmacist will always provide a final check on all of those. So it's a busy day. I can honestly say my day goes very, very fast. I love being busy. I would hate it if I had to sit around and, with nothing to do. And I like challenges, so issues that come up, I don't mind addressing them. I've been doing it for, 36 or 37 years, and, I still enjoy it. Does it get stressful? Yeah, there's days it gets real stressful. And I'm sure Kim can tell you the same thing. There's days when, you'd like to just go home for the day, but you got to address what's in front of you. And I think that's probably in any job nowadays. Most companies now, and hospitals are no different than any other company. People are doing more with less. So as people retire or as healthcare changes, more tasks get added on, more professional responsibilities get added on. And, but I enjoy all those challenges and all those responsibilities.
Okay, great. Thank you, Kim and Gary. I heard a couple themes. We were kind of joking about how very different your careers are, but obviously there is one thing in common: science. I mean, you were both interested in science to begin with, but you just kind of ended up, in different little aspects of it. And so I think, that's one thing I'd like to say to all students. I'm fascinated by people's career pathway stories because it's never a clear, straight line from here to here. There's always some weaving in and out, some spinning, moving over, moving down, moving up. And so what's neat to see here with Kim and Gary is that they started out with one thing in mind, and then kind of fine-tuned it, as they got experiences, as they started working, as they worked in different places. So career exploration isn't something that you do from 10th through 12th grade and then go to college and you're done. It's gonna happen every day on the job. You're gonna learn something with every different employer or every different environment that you work in. So definitely like to share that information with you guys, or point that out before you head off to your next step, that it's okay if you change your mind and you go a different direction, or if you fine tune it. Another,
If I could add to that, Kate, I strongly agree with that. It is right now, everybody's asking you, what do you want to do? What do you want to major in? What do you want to do after school? But I would rather have you look at at the rest of the 12th grade year, or the next 4, 5, 6, 7, 8 years. It's the time for asking questions, not having all the answers. Stay open, keep your ears open. If you're at a job and you're finding out that you love talking to your friend about their job, you find out a little bit more about that. Now is the time to ask questions. Now is not the time to have all of the answers. So just stay flexible, keep asking more questions. So
Exactly.
I do feel that that's the best way to find the best fit for yourself.
Yeah, exactly. And just to kind of expound on, I couldn't agree more, Kim. Everybody wants to make that decision, and sometimes things change when you get to that first year of college or that second year of college. Your interests might even change, somewhat. But the most important thing is don't lock yourself into something just because you think you made a decision and that's what you have to do. Once you get all of that education done, you're going to be working for a lot of years. I've been doing this for 36 years, and if you're going to do something for that long, you better like what you're doing. I can't imagine, having to go to a job every day that, I just hated walking through the door. So don't lock yourself in.
I totally agree with that too. If they say you found the right career for yourself, if you would actually do in your free time, when you're not getting paid for it, what you do when you're at work. And so, is that true? Do I go for walks? Do I drive boats whenever I'm not at work? Absolutely. Do I spend time in the outdoors listening to birds? Yes, that is what I really enjoy doing. So I feel fortunate that I found this job, but I didn't find it right away. Again, I was 39 when I first started working for Pennsylvania State Parks. Wait, I didn't tell you how many years I've been working here, have I? Because now you know exactly how old I am. So don't do that math, not math class. So, but I've been here since I was 39. That means up until age of 39, from time I graduated at 18 until I was 39 years old, I made the wrong choice. But I could look at it was the wrong career choice, or I can look at it as I spent 21 years learning, asking questions, and trying to figure out what I wanted to do. Meanwhile, I was working jobs, but I just didn't find the right job. And once I found the right job, boy, did it make a difference. It was the right fit. I was happy here. And yes, like Gary said, I love coming to work, and I never know what to expect.
that's great. Another thing that I've heard, or that I'm glad a couple of you both mentioned, was doing something different too. So Kim mentioned that if the flower bed needs weeded and she walks by and sees it, she might just, stop and weed the flower garden that day. I mean, she's working in a state park, and everybody that works there wants to make it feel beautiful. And so there are things that aren't part of her job description that she's going to do just because she sees it. And Gary mentioned that, if he's short on a pharmacist well, he's not going to be doing that every day, sorting out pills. If he needs to step in and do it. So just because he's got a more prestigious title doesn't mean he's above. And one thing I remember several years ago, and I heard an employer say that their definition of, what is a work ethic? And that employer's answer was, you see work and you do it. So, in my office, even though I'm the executive director, if the copier is out of paper, I'm going to put paper in the copier. You're not going to wait for the person whose, job is to manage the copier to do it. You just do it when you need to get the work done. Let's see. You guys have given some really good advice. Any other comments or suggestions, thoughts for these students? We have just a few more minutes. There is one student, I will say, that is going into healthcare, and there is one student that is going into environmental studies. So you guys have a good audience here.
One of the questions you asked is what advice would you give them? And I think for an environmental educator, and then I hear as a director, both of these jobs require leadership skills, they require public speaking skills, and they require some self-confidence. If you can picture yourself in this career, you have a better chance of succeeding in this career. So you may not have, I was very shy all the way through college. But the way to overcome some of that is get involved in the extracurricular activities. My own personal path was 4-H and FFA. It might be Scouts or some other youth organization, maybe through your church. Some of the other ideas, maybe debate team, or if you're going to be in student care, you just show up because you get out of class that day. You show up because you want to make a difference. Let your voice be heard. Practice letting your voice be heard. So get used to just speaking in front of people, but communicating in a clear way as needed. Gary, did you want to add anything to that?
The only thing I would add, I guess, as far as advice is, right now, if you're going to go into the medical field, I mean, there's always going to be positions there. There may not be as many as there were years ago, but I mean, the baby boomers are getting older now. More people are going to need medical care. So whether you want to be a pharmacist, a nurse, a radiology technician, a lab technician, I mean, there's always going to be jobs out there. You may have to travel. You might not be able to find something in a local area, but I can tell you most of my staff here is local. I don't really have anyone that's, from outside of the area. So, they all wanted to come back here just like I did, and they were able to come back and find a job. Persevere, once you get that job, if you really want to do a good job, like Kim said, if there's work that needs done, do it. I've taken patients to the bathroom, and I'm a pharmacist, because the nurse was too busy. Sometimes you just got to do what you got to do. Don't be shy. People are counting on you, especially as a pharmacist, you're a drug expert. So, when the doctor calls and the nurse calls, you need to be, forthright with them, and you need to get them the information that they need. If you don't know, you at least need to know where to go look for it. So, the worst thing you can do is kind of be screaming and back off and kind of hunker in the corner. No, you need to be positive. You need to communicate, like Kim said, and you need to really keep in mind that the one thing I always keep in mind is, what if that was my wife or my mother or one of my kids, that they just called about. And that really puts it in perspective. It makes it more personal.
Excellent. Okay. Any questions, comments from the students? You guys want to hear more from Kim or Gary, or if you want to, do a volunteer experience with them or check into maybe some open positions this summer with their organizations, just ask Mrs. Kopp, and she knows how to reach out to us and get you in contact with them. So that's it for us today. Thank you very much, Kim. Thank you also to Gary for taking time out of your very busy days to talk to us. I can tell that you enjoy talking to the students and enjoy sharing your wisdom. So hopefully we'll see you again